Well, hello, we are back, and as I promised, we are very, very honored and looking forward to a chance to talk with a return guest, or a returning champion from Lawrence, Kansas, Dr. Hiten Soni. Welcome.
Well, thank you. It's so good to see you.
Yeah, it's been
good to be seen. Good to see you guys as well. It's been a while.
It has. It really has.
One of our first old radio show. Now we're going rogue on YouTube, which is nice. We don't have to worry about FCC censor in the other room hitting the button every time we say hard on or something like that.
Right.
Exactly.
Yeah.
Exactly.
Well, that's wonderful. So I know, like in one of the lecture I was giving to a third-year medical student, and I used the word erection, and they're like looking at this. Like, can you say that? It's like it is medical school, you know, and these are like young kids, you know, like kids, and it's like 25, 27. And it's like, yes, I want you to use these words, please. Yeah,
It's
erection.
the same way I ask therapists, do your copy of the DSM, do you staple that section closed, the psychosexual disorders, just staple that whole chapter so you can just pass right over it?
Yeah.
Yeah.
You know, I want to start with that actually.
Go ahead.
You gave us a good starting point. As you know, as we've been talking about men and what men generally don't know about their bodies and sexuality. And again, we certainly want to talk to you about where guys can go and who they can talk to. But I think we have to address this, you know, not so big elephant in the room, that do doctors really know about sex and sexuality? Are they really taught any of this in medical school?
Oh, I was shocked when I went through the medical school. We had zero. Okay, besides from what you learned in anatomy and the physiology, it was zero. So it was quite shocking. So the first time when I wanted to seek out, and I took the class with Dr. Ranshaw and the sexual dysfunction clinic, and so even when we were learning history, taking and practicing, and we would just say, well, any trouble in a bedroom? It's like yeah, like
the laundry's piling
the
up.
drapes don't match the bedspread, or
right, or is the ceiling leak in the bedroom?
Right.
Like, what do you mean, like trouble in the bedroom? Like you need a new carpet, or
That's
yeah.
the thing to ask.
Yeah, so the history taking part was very poor. We this is video, right? It's gonna be okay.
Yeah.
So good. So I can actually tell you. So we are doing the training. And so this gentleman, he's from Saudi Arabia, and part of the training is to take it's a mock patient, they call the standard patient. This is an actor, and so he has to take the history, and in the history he goes, you know, you and the missus, you know, and that's the gesture he uses, and we have to stop him, and it's like, so what are you actually asking? He goes, you know, it's like, no, you have to use the word that how often do you have sex? Can you say that?
Right.
Okay. Is it this experience?
Concerns. How hard is it to say?
Yeah. Are there any difficulties? Anything you want to talk about? And it's like, yeah. So taking history was teaching students then to taking medical history, and then making sexual history as a part of it. And it's like, well, the quality of life,
right?
It's so dependent on it. And then if somebody comes to you and you completely miss it, then you haven't done that patient service. And so first we need to really make sure that the doctors, we need to go out there and get to the medical schools right there in the third year, fourth year medical students, and start teaching them that yes, cardiology is wonderful, nephrology is good, there's no doubt about it. But for some reason then you can't relegate these things out of the primary care realm.
I'm glad you said that. Yeah, because we were talking earlier. I think there's this knee-jerk reaction that women automatically think their gynecologist has the answers, and guys think the urologist has the answer. And as Larry said, guys don't go to the urologist until their
No.
prostate starts growing,
Mm-hmm.
right?
Mm-hmm.
So if gynecologist, Larry used to say this years ago when Dr. Soni and I were both trained by the late great, and as Larry was as well, by the late Susan Lee.
Yeah.
And she was one of the first to start attracting, such as you, medical
Yeah.
clinicians to get this kind of training in sexuality counseling. And Larry's favorite joke was, hey, those genitals you're working on all day? Just remember they're attached to people, and people use them in ways that affect their lives and their relationships.
Yeah, that's hilarious. Yeah.
That's technicians, right?
Yeah, exactly. Then you just pretend that it doesn't happen, and then you start teaching the history taking, and then start getting them to use the words, the vocabulary, getting them to say penis and vagina and fluids and things like that. These are not bad words. We need to get them to use them in a discussion and say, well, let's see. So one of the questions that we would ask is, so how old were you when you had your first sexual experience? And then you would come and ask the second question. So how old were you when you had your first sexual intercourse? And they go, oh, well, let me go back and answer the first question then. Because it's like they think that it's the same thing.
Exactly.
And it's like, it's not. And one of the other things that I learned from my medical training, as inadequate as it was, Dr. Kumar would tell us, he goes, do not ever ask to like a 14, 16-year-old if they are sexually active, because you just assume that they are.
You're right. Right.
And just say, when was the last time you had sex?
Mm-hmm.
And you're asking a 14-year-old, how did you know? It's like, yeah, just ask it. Yeah. And
Better to assume. Let them tell you, no, I haven't yet, instead of those back tightening questions like, do you masturbate? No, of course not. I'm not supposed to. I just said, how often, or when was the last time?
There you go. How often
that everyone does.
Yeah.
And then let them tell me, no, I don't masturbate.
Mm-hmm.
Then I want to know why.
Right. So the primary care ought to be the place, I think, that we would go.
Medicine, right? What's the distinction? Would you say family medicine or?
It's the same thing. The primary care, family medicine, yeah, and that's where it ought to be, because then we say that we take all the other histories, like any frequent headaches, any difficulty breathing, chest pain, stomach ache, any problem with erections. Yeah. And then you just make it very normal as a part of that, and then get it. But you're so right about the education. You think that in 2020, then we would have come far ahead in terms of educating medical students. Well, what are you guys seeing?
Well, kind of the same. I mean, there's the circles, the folks that we know, the folks who do recognize that it's an important quality of life issue. And again, not just urologists and gynecologists, some cardiologists and gastroenterologists, neurologists, right? It's starting to spread, but it's just still very, very small. And even, sexual medicine, we like to kid around and say it was born when the FDA approved Viagra in '98, but it's been around, at least a century.
Right.
But it's just never
really made it to the surface.
Yeah. So just encouraging people and doing podcasts like this and making it part of a normal everyday conversation, taking the stigma out. And in my psych practice, it's part of the bread and butter. That's what. So every psych eval we start with the orientation, and we go and we ask about the functioning, and then it's like, wait, it's our first meeting, It's like, yes,
Right.
well,
Oh, I
yeah,
love that. That you used to get that family
yeah,
therapy.
and it's like, well, I came for depression, and it's like,
Hmm.
well, yeah, we will help you with the depression, but we want to know, and we ask about the orientation, and with the younger people, it's a lot easier now
Sure.
to do that. But
Yeah.
you know, somebody in 50s and you know, in the 60s even, like our age, you know, and then it's still hard to, well, not you know, our age. You're younger.
Thank you. You've now just become my favorite person.
Yeah. But so in our age, so I ask people, so how do you identify yourself? And he goes, Larry? I identify as a Larry? And it's like, no, like, can you tell me, like, how do you say, how do you identify, like, orientation wise? And it's like, well, you mean like north? So like what? Like which way is north? And it's like no. Then you have to come out and say, well, do you think you're straight, bi, gay? Oh yeah, no, I'm normal. Yeah. So it's like, okay, normal. Okay,
Right.
well, like,
Yeah.
so what I'm hearing that you're heterosexual is what you're saying. Yes. Yeah. What else? Like, yeah, but just need to know. You know, I'm just asking.
Mhm.
And then it takes a long time sometimes for them to like just come out and ask. And I just break the ice on that very first thing that, hey, listen, if we can talk about anything in here, and then you don't have to. So in the psych practice, you know, it's kind of lends itself to get there. So when I see people with the depression, we will talk about that. When I see people with the anxiety, we will talk about it. So there's no age limit either. You know, it's like
Right.
some like a 93-year-old, then we will talk about that. It's like,
Right. It's another common
yeah,
mistake. People just assume that you know, gerontology, oh, there's no sexuality there. They don't have to know.
Right.
yeah,
And, you know, it's funny when you talk about assumptions that many physicians make, because I do a lot of work with seniors and have been for the last
yeah,
couple of years as well, as you know.
yeah.
But I find it very interesting that many physicians will work under the assumption that adolescents are sexually active, and they will work under the assumption that anybody over 70 is not.
Yeah, that is
Of course,
just
we know
not.
what a huge mistake that is in South Florida when the dating criteria goes from looks to money to conversational skills to, well, he drives at night.
Right, exactly. That's high status.
Yeah, right.
Yeah.
Yeah,
So,
that's awesome.
Hiten, I want to ask you again, especially
Yeah.
since you're seeing this in your psych practice and you are asking these questions. Are there any sort of common themes or any things that have been coming up for you that you've been seeing clinically that are issues that men seem to be struggling with?
Oh yes, very good. So this is what most commonly happens. Uh, so we go through all this. Oh yeah, everything is good. Everything is fine. We will talk about my depression. We will talk about that. We'll do sexual history. Yeah, no problem. And we call this the doorknob
Right,
bombs. Yeah,
right.
you know about this. Okay. As they're leaving, oh, can I get a script
By
for
the
a
way,
Viagra? And
uh,
it's like, well, have a seat. We just talked about this. And so, you know, it's like, no, just give me the script. We don't want to talk about it. It's like, no, it doesn't work like that. Why don't we make another appointment for 45 minutes next time you are here? So you are
Oh, the
not gonna give
unicorn.
me you're not gonna give me a script? It's like, well, I can give you a script, but it's not that simple to just
Right.
give you a script.
Let's talk about how to
If
use it.
Yeah. So we want to talk about, so is this a situational erectile dysfunction? And so, and that was also another thing that sometimes I see. And, oh, I only get erection if I watch porn. Okay. And I was like, oh, so it's a situational thing then. So you do get erection, but you have to watch porn to get it. Oh, so then how do you maneuver it with your wife? Well, I'll sneak into the bathroom, and I'll watch. And it's like, no. Why don't we just talk to your partner, and let's make it a part of the foreplay. And so that's often one of the things, that there is a shame. If I need a Viagra, it's going to fix everything, it just,
Exactly.
yeah. So we don't have to really talk about anything. You just give me the script. I'll take the pill, I'll go into bathroom, and I'll watch a little bit, and then I'll come out. It's like,
Spring
no.
out of the bathroom with an erection.
Yeah,
Ta-da!
ta-da! I got this.
Right, exactly.
Yeah.
Right.
Yeah.
It always works so much better than learning about intimacy and talking to your partner
And
and being
maybe-
comfortable with yourself.
Maybe being aroused by your partner's pleasure.
Sure.
Right?
Yeah.
Instead of thinking
Absolutely.
erections are mandatory equipment we have to show up with, and
Right.
understanding that they are the result.
Mhm.
Yeah.
And
So
let me
there's
add, the relaxed result
Yes.
right.
around.
Yeah. So there is a lot of that misinformation, often what they think the problem is, and how to talk about it. And I think we really, it's so awesome that manly men, we are sitting around and talking about erection with each other, and we are not afraid, and that's what we need to then normalize, and to say to people, hey, listen, this is okay. Like your eyes, nobody's afraid of wearing glasses. It's like, well, you need a little help reading? Is that what you need? Oh, okay. And then, so what is so difficult with needing help? Oh, you need help with the blood pressure, do you? Okay. Diabetes? Oh, you need a little insulin. Okay, not a problem. But then there is a sexual problem. Oh, no, I'm not man enough.
Mm-hmm.
And it's like, so there is that machismo, or how do you call it, that real, what does it mean to be a man? And we don't talk about that, and we have this stigma that somehow it's like, oh, we don't talk about our feelings, and we definitely don't talk about sex. I mean, it's just something that we often brag about, and we make up that story, in the locker room. So I often find that even in the 50s and 60s, but the younger generation, I'm so proud that they're doing so much better. And I think the society is still changing, not as fast as we would like, but we are still not there yet, I don't think. So there's a lot of work for us to do right here.
If we can get the politics out of it,
That
it's
would
just
be
right.
so absurd that sexuality has anything remotely to do with politics, but the United States. I've just really always been curious. I'm sure you told me this before and I've forgotten, but tell me again how you ended up in Lawrence, Kansas, of all places.
Oh, very good. I'm glad you asked. So, yeah. So what happened?
The literal middle, if you held the country up on a pencil, the exact balancing point would be Lawrence, Kansas, wouldn't it?
It's very close. Absolutely. You're so correct. Yeah, he knows his geography. Very good. Yeah. So
William S. Burroughs, I remember, said that.
Yeah. So when I did the residency, it was at the UMKC. So it was on the university. And then when I was finishing, I was fairly late in my life. I was like almost hitting 50s and graduating, and I wasn't sure like where I was gonna go get a job. My daughter was starting high school, and it was very difficult for my son to move in the middle of the high school years. Oh, he still hasn't forgiven me. I'm still paying for the therapy for that. and so it's just like, she played hockey. And so there aren't any hockey places in Kansas, but so, and there's one rink in Kansas City. And so I had two job offers. One was in Salina, Kansas. Yeah, I know nobody knows where that is either. Even in people next door to Salina, it's like, where's Salina?
Yeah.
It's like next door. It's like, no, I never heard of it. And then the other one was in Lawrence, Kansas. So unfortunately, everything you have, and I'm going to get letters from this, from your viewers in Kansas. Dear Dr. Soni, we don't feel about that, about Kansas. But unfortunately, everything you have heard about Kansas is true.
Yeah, I did a little time there.
Yeah, so you know what I'm talking about. Yeah. So if I had to live anywhere, Lawrence would be it, because it's university town. You have like people from all over the world coming in here, and there is a little blue island,
right.
and
Yeah.
Yeah.
Right.
And so if you had to be anywhere in Kansas, then you'd want to be in Lawrence. And so we could commute to Kansas City. It's 45 minutes, and she could keep playing her hockey.
Nice.
So for 4 years, she stayed and played hockey, and we would commute from here to Kansas City. It's a 35-minute commute, which is not much of a commute at all.
No.
So we ended up in Lawrence, and I just enjoyed the university atmosphere.
Yeah.
So some of my patients are like professors, and you can take classes. The bars, when they were open, now they're
Right,
closed.
right.
But the music was amazing. The international food, and all these people from all over the world, coming to KU.
Oh.
Mm-hmm.
Yeah, so that's why
That makes
it's
I
sense
like that campus a lot,
Yeah.
actually.
Yeah.
Time when we were there.
Very good.
Mhm.
Yeah, so that's how we ended up in Lawrence. And then once we got here, we are just very happy. So we are just staying here. And so, yeah, so it's a fun place.
I know that's not a Kansan accent. Remind me where you originally hail from.
Oh, I am from Bombay, India.
Ah.
Yeah. So,
Thank you for putting your Bombay on and
Okay.
doing that.
Yes. Yeah. So this my kids would do that. Hey, Dad, when we go to see, like some of my cousins, and they will have this nod, and that nod is like very confusing. It's like, is it yes? Is it no? But we have that. It's like, what the hell is that? And so it's like, just don't ask, just go with it. So if they nod, you also nod like that, and then it'll be all work. Just work itself out. And so when we went to, it was hilarious when I took the kids to India, and they were like, the whole country looks like our cousins. It's like, well, they didn't have that. And you go, I didn't know there were so many people that look like us. It's like, yes. Yeah. So, yeah. So I'm originally from India, but in Kansas I get that a lot. People will ask, "Where are you from?" So I tell them I'm from Chicago. It's like, no. Where are you really from? It's like
Right.
my mother's uterus.
Yeah.
It's like, where are you really from? It's like, okay, yeah. And then my all-time favorite, when if they come to the office, it's great. You're Dr. Soni and you see stuff, but they meet you like in the street, and somehow, like my parent, my kids' friends' parents, I don't know why, but they feel obliged to speak slowly and loudly.
Sure.
And it's like,
Well, that's what you do when somebody has an accent.
Yes.
yeah. Do you think, like, if we ever go to China, the Chinese people will speak slowly and loudly to us? Ni hao ma.
It would be helpful if they did, but
Yeah.
you know what?
So anyway, I'm
Americans will
digressing.
speak
This
that
is
way
fun.
to Chinese people in China.
Yeah. So let's get back. I'm sorry, I digress.
Oh, no worries. No worries. So I want to, because you kind of indicate, right, when you're talking about being proud of a lot of the young people and the way they're handling a lot of these sexual issues, especially compared to older people. Do you find that especially younger men are not only more willing, but are they more able to speak intelligently about their bodies and sexuality?
Oh, yes. I find that the younger men have the vocabulary, and they have the vocabulary. There is a lot less stigma. There is still that a little bit of there is a little bit of hint, just a hint of homophobia sometimes. You'll see, at least in the Midwest, where they have to, like, and how about them chiefs, and it's like, yes, that your masculinity is safe. Yeah,
Right.
we can. But there is a little bit of that. Like, if I talk to another guy about it, what does that mean? And it's like, well, your cardiologist, does it matter if it's a guy? Do you so then you can talk to your shrink about this, and then when you say, and you ask them about the erections and ejaculations and things like that, and especially if they're taking any antidepressant,
Mhm.
We have to go there. There's no
Absolutely.
way I'm going to give you an antidepressant and not touch that.
Right.
So we will definitely
Well, at
touch
least
them.
talk about it.
Good. Absolutely, we will talk about that. Like, oh, no touching.
Yeah.
No touching. Just talking about it. Yeah, so we definitely would go there and discuss it. It's like, hey, listen, I'm gonna give you these pills, but I want you to keep an eye on some of these things because it's fairly common, and if it happens to you, it's 100%. And that is a difficult concept because everybody's got Google now. So, and they'll go, it's like, oh, it seems 17% of the people who take these pills may experience some sexual side effects. And then it was like, well, yeah, 17%, I get that. But if it happens to you, then it's 100%. And at that point, we cannot say, well, don't worry about it. It only happens to 17%. Like, no, it happened to you. So it's 100%. So that's why it's important to me that we talk about this before I give you the pills. And when you take the pills, you are well informed that not everybody will have this, but should you have it, that's the most important thing is that if you have it.
Right.
Because then it is 100%. So we asked them that, yeah, you can Google it, you can do all this thing. That's a wonderful thing to be educated about it, but then to take it seriously, and we would discuss it at length sometimes too. And then we would even ask, like, hey, next time, can you bring your girlfriend? Can you bring your boyfriend? Or can you bring them both? And then we can talk about that, and then we can go there and discuss it and see, because sometimes the men may not notice, but their wives or the girlfriend or somebody will say that it doesn't feel the same. The drive has kind of gone down a little, and then he goes, really? And they'll be sitting next to them. It's like, yeah, honey, and it's like, well, you didn't say anything. Well, I'm saying it now, and so we get that. So we give that opportunity to discuss that and to say that, hey, this is an important part of the overall treatment. And I don't know who came up with this, but if a side effect of an antidepressant is lost in sexual drive, that would make a depression worse.
I've been
Because
saying that for years. You
We
think they
both
were
have.
depressed before?
Right. We both have. One guy's
Yeah.
walking into your office going, can I please go back to being depressed?
Right.
Because at least I was
I
getting
was
some,
depressed, but I got hard.
Yeah. So that's why we say that this is linked together. There is no way that we can ever talk about your depression in the absence of a sexuality. Because it's like,
I think sometimes therapists get overexcited. They go, oh, you're on an SSRI. That must be it. We have to remember that depression can cause erection problems as well.
right. So if the answer was that simple, they wouldn't need us. You would just go to your primary care and get some pills, and and Dr. Lee would say that, and even Dr. Renshaw were saying that in the 90s when the pills were coming, and it's like, wow, is this going to be an end to this? It's like, oh no, because the answer has never, when has the answer ever been in a pill, no matter what the diseases are? Exactly. So because it's something as complicated as sexuality, yes, there is a biological component, but it is just the one component. It's a multifaceted, complicated system. And so how is it that you can have a morning erection sometimes, but you don't have erection with it? And this is what I had learned in your class, and I'm so happy that you taught me, because we were always told that the morning erections was a full bladder.
Oh.
And then you were like, hey, wait a minute, that isn't true. And it's like, and you asked the class questions. I remember I was in the class, and you were like, oh, he's right. And it's like, well, that's why he's teaching the class and we are not. Yeah. So that was kind of interesting. So we say, hey, so you're getting erection other times, But then when you have to have sex, sometimes you're not. So what is happening? And that is a situational thing. The pill isn't going to fix it.
Right.
And so this is something happening in the relationship. Oh yeah. And so I get this often, you know, and we'll get that. You go, well, I was laid off, and then I was at home, and then I was doing laundry, and you know, he wants to help out, and I get that. But then all of a sudden, something happened because she comes home, and all the roles are reversed, and the gender scripts, and it's like starts doing a number in the dialogue in your head. And I was like, wow, I was cooking today, and then I was doing laundry, and then I had to do this, and then when she came home, I was exhausted, and then I did, and then I didn't. And it's like, well, we need to talk about that, you know, and to say, well, it's not just an erection problem now. The gender scripting is kind of turned its way on its head, and then so now you don't feel like a man enough or something.
Never too tired. That
Exactly.
same guy 20 years ago would work a double shift and run home on foot for the chance
Yeah.
to have sex.
Yeah.
Now he's-
And now, yeah, and so now he's like, oh, so it's like, is it that you are tired? And I get that, you know, we get that because it's yeah, I get that it's a lot of work, and the women would tell us that those who work in home, and they would say that it just never ends. The work never ends at home. So the men often would come home, like, what did you do today? I was working busy, you know, I was making money. And it's like, well, her work never ends. It's like a 3 full-time job.
Right.
So now when the shoes are reversed, you know, and then now it feels like, oh, so you're doing some of this. And then all of a sudden I'm tired. It's like, if you're tired, I get that. But is there anything else happening?
Right.
And then it will come out that, well, you know, because when she comes from work and then she talks about her work day.
He's
And
emancipated.
yeah, and I don't want to talk about her work day because I've been cooped up in here with the kids, and I'm doing this, and so do you see any of that in your practices? Yeah.
Yes.
Yeah.
There is that gender scripting is starting to change a little.
But yeah, I was going to say also older folks more so
Right.
than younger. Yeah, and I'm happy to see, again, giving some credit to millennials and Gen Zers. Polyamory is a lot more normalized, and kink is normalized. Though I met an interesting couple recently that were 180 degrees apart. She was really, really kinky, but just could not bear the thought of another person. And he wanted to open the marriage, but was so vanilla that he couldn't do any of the kinky things she wanted. People tend to think if you're kinky, you're poly. If you're poly, you're kinky. Very different world sometimes.
Right. Right.
But
Yeah, so
we'll have to have you back to talk about that world, because I know that's
absolutely
an area of interest for you as well. Yeah.
Yes, we'll definitely do that.
It's just been such a pleasure catching up and seeing you after it's been too many years.
It's way too long.
So
yeah, let's do it again soon.
absolutely,
Yes.
my word. We will be talking soon, and we got some other things to talk about too off air. So
All right.
we'll be in touch very
So,
soon.
Well, thank you,
So
gentlemen,
again,
for having me. I had so much fun.
Soni from Lawrence, Kansas, psychiatrist, sex therapist extraordinaire.
Indeed.
Keep up the good work.
Yes, indeed.
Thank you,
Thanks
Thank
so
you out
much.
there.
Yes, absolutely.
Bye bye.